The Marina Del Rey Hospital HealthCast, featuring the doctors of Marina Del Rey Hospital.
Now, Dr. Ghozland, you mentioned earlier diet, exercise could be factors in problems with women and also treatment for women. What are some of the things that you recommend and you see?
Like I said earlier, before we rush to surgery, we want to modify lifestyle a little bit.
Right.
When you're dealing with urinary and stress incontinence or pelvic floor dysfunction, such as pelvic pressure or organ prolapse, which means that you're starting to see some descent of your bladder, there are certain things you can do to alleviate the symptoms by simply changing your lifestyle. First and foremost, I mentioned earlier, you want to decrease the amount of caffeine you consume for the following reasons. One, it will exacerbate your symptoms of urinary stress incontinence, especially if you're taking it in the evenings. I usually recommend after about 5 p.m. to stop consuming caffeine.
Okay.
And caffeine's not just coffee. Caffeine is in a lot of things. It's in dark chocolate. It's in teas. And people have to really realize that it's not just coffee, but other consumables that may contain caffeine. That in itself will probably help a lot.
It's a hard thing for anybody to do, to change their lifestyle, but then you're talking about taking caffeine.
We're also busy
scaling it
today.
back.
Yeah, absolutely. The other thing I highly recommend is we eat so many starches and carbs, and by increasing the amount of leafy green vegetables or we can really minimize the amount, and I hate to say it on the radio, constipation.
Mm-hmm.
Because the smoother your bowel movements are, the easier it is on your pelvic floor. So decreasing caffeine, maximizing the amount of vegetables and greens that you consume will definitely help at some degree with the amount of pelvic pressure and to decrease some of the urinary stress incontinence. Obviously, doing daily exercises will enhance and better your life and also increase pelvic support. But there are certain specific exercises that we can do. We've all heard of Kegel's exercises, but what is a Kegel's exercise? First of all, I always tell patients, we live in Southern California. If you drive a car in Southern California, you should be a Kegel's expert.
Really?
And the reason that is because we come to so many red lights when we drive.
Yeah.
That instead of remembering, I forgot to do my 20 sets of Kegels today, every time you come to a red light, I encourage my patients to do a subconscious Kegel rep.
What is that?
So that's just try to contract your pelvic muscles so that you're really, I hate to use the word because I don't like to associate it with imagining to stop your urinary stream, but it really is almost like that.
Okay.
But the key is to do it in a slow fashion. You don't want to do quick contraction, quick release. You want to do a slow contraction, hold it, release slowly. So it's a 1, 2, 3. You do that every time you get to a red light. You're going to do enough Kegels exercises in Los Angeles to definitely help your urinary stress incontinence issue.
With the traffic in Southern California,
absolutely.
You'll
sit
be
on the 405 and you're cured.
So
for the most part.
So I say as simple as lifestyle change, but we all know lifestyle changes aren't that simple. Whether it's exercise or diet, eating more greens to help your system out, or just scaling back on caffeine, which everybody should probably do. It's just some simple things that women could do initially to see if they helps their problems.
One more thing, and I think it's really important. We always talk about weight loss.
Mm-hmm.
That is probably, aside from caffeine, the number one helper of urinary stress incontinence. If you look at extremely obese patients who are going in, let's say, for a gastric bypass surgery,
okay,
or a sleeve, I'd say most of the time they not only want to lose the weight, but they're complaining of urinary stress incontinence. They can't hold their urine. There's too much pressure there. The moment they lose that 100 pounds, the 50 pounds, the 150 pounds, you see a huge reduction in urinary stress incontinence issues. So weight loss and being at your fittest really is a huge part of helping in solving urinary stress incontinence.
The Marina Del Rey Hospital HealthCasts, featuring the doctors of Marina Del Rey Hospital. For more information on any of the topics discussed or to schedule a consultation, please call the Marina Del Rey Hospital helpline at 844-MISI-4U or go to marinahospital.com.